Every year, hundreds of women will say they're going on a trip or visiting family in Connecticut. But really, they'll be going ham at a med spa.
Hi, I'm Dr. KD, and I wanted to tell you today about how much I admire Chloe Fineman. And here's why. So she's an actress on SNL. She's 37 years old, and she recently put out this Instagram reel all about what she calls botched med spa procedures. And basically, none of the pictures look botched to me. They all look like they're post-procedure pictures. And the whole thing is pretty hilarious. It's kind of a spoof. And I wanted to share with you what she said, but also what it looks like she probably had done from these pictures. And her basic point is a lot of people who care about their skin go and have these procedures at med spas. They pretend they're going to visit their aunt in Connecticut, but really they're going to the spa and they're hiding in their apartment for a few days while they recover. And at the end of it, she's like,
This year, I pledge to stop the cycle. Just kidding. I'm going Friday.
So let's see the pictures that Chloe put out there. So first of all, it opens with her showing her skin. She's clearly had a procedure. Her skin is very red, and she's got some hyperpigmentation on her cheeks. That is very common after certain procedures. Oftentimes those procedures are done to get rid of pigment. And what happens is the pigment gets a little darker and then it sloughs off, and then it's much lighter afterwards. And sometimes you have to do a few treatments in order to get rid of the pigment. And so the thing that maybe she had for this treatment could be an IPL, which is intense pulse light, also known as BBL, which is broadband light. But what happens is that for the pigmented spots in your face, they get darker right away before they slough off. They kind of look like coffee grounds. So it's possible that's what she had here. I don't know. I'm not her doctor. And actually, she lives in New York. She does SNL, although the place that she talks about going, and she's been very public about her participation in the med spa world, is actually in Marin County in California. So that's what I think maybe she's done here is some kind of IPL. In this next one, it's really interesting. She looks very different, doesn't she? And she's very red and splotchy. In this case, she doesn't really have the brown spots so much, but she's got a lot of red splotches. This one's a little bit harder to tell. She's kind of got a lot around her left eyelid. And that's pretty unusual because we don't typically do stuff there. There's a few things we can do in the upper, like right below your brow, but right around the eye, she's very red there. So it's actually really hard for me to tell what this was. Your skin could look like this from a peel, but again, you would never put the peel close to your eye like that. It could be looking like this from various kind of facial treatments that are like facials. Could be some microneedling. It's kind of interesting. She's not that swollen here. So she didn't have a really big procedure. So this one's kind of hard to tell. Now here, clearly she's gotten some lip filler and it does not look good. Okay, so her upper lip looks ridiculous here. So either they put just way too much in her upper lip. I mean, this is just it's pretty bad. So typically when we do filler for lips, it's because people have lost volume in their lips and they want to plump them up a little bit. And you can do that very subtly, and it can look really good if you do it carefully and not too much. Clearly, she's had way too much here. Her lips look a little ridiculous, and they're clearly swollen. So chances are, once the swelling's gone down, this will look a little better. But clearly, someone put way too much because generally your lower lip should be a little bigger than your upper lip. And here, her upper lip is way crazy huge, and the lower lip looks pretty good. So if this were my clinic, she walked in like looking like that, we would dissolve a little bit of that in the upper lip so it looks a little better. Now your lips will swell up after you have a filler. There's no question. They're going to look crazy. And you might love that or hate that. If you really love it, when the swelling goes down, you won't be happy anymore and you want more. But most people are like, oh my God, what did I do? And then a couple of days later, the swelling's gone and it looks pretty good. But here, there's something wrong because the upper is way too big. Let's see what's next. So this one, she's just really red. It's kind of hard to say what she's had here. She's a little swollen also. You can see because Her nasolabial folds just like puffy. She just has a very puffy look. Here, this is really interesting because she looks much closer to herself here. You can see a lot more pigment. So maybe she's had a laser or another BBL where you can see the pigment's very prominent on her skin. Again, she's very red there. Now here, she's crazy swollen. Do you see that? The difference? She's a pretty slender person, and here her whole lower face is really, really swollen. We see that sometimes with some laser and some RF microneedling. She's a little young for RF microneedling, but she's kind of a famous actress. Maybe she's doing that kind of early. Let's see, salmon jizz. Let's just cover salmon jizz for just 1 second. I did a whole episode about salmon jizz, which is really using salmon sperm, which essentially is DNA. It's a source of pure DNA, and they happen to get it from salmon. If you want to know more about that, I did a whole episode about it. It was really interesting. Salmon jizz was something that John Oliver and that show used to describe this salmon sperm facial that people have been getting. So that also was a really fantastic segment on John Oliver.
The procedure is said to be a natural way to achieve a baby face with Botox-like effects.
Look, if staying young and beautiful requires $800 quarterly injections of salmon jizz to the face, then count me out. While the boom in salmon sperm facials might be terrible news for all the salmon who hope to be fathers one day, it is great news for your friend Doug, who's been quietly hoarding salmon jizz for the last 5 years.
It was kind of based on my book, and he was just making fun of it. In actuality, you can use DNA broken up into little bits derived from salmon sperm, and that can actually cause a significant amount of collagen buildup in your skin. So that's actually good. So it's not totally crazy. Now, Sculptra is an actual injectable that we use that generates collagen kind of in and under the skin. When you do it, your face is super puffy when you're done because it goes in with diluted in a whole bunch of water. You can sometimes have bruising. She doesn't actually look like she's had that in this particular picture. In this particular picture, you can see again, her skin is very red and she's got all these pigmented spots that have come to the surface. So my guess is this is again, BBL or an IPL rather than Sculptra. Sculptra we tend to do in people my age because I'm, oh my gosh, 20 years older than Chloe. Sculptra is something that we do that it will lift, it will build volume, and it will really help with drooping skin. So it refills volume. So it's very helpful in people who are relatively thin. They've lost some volume and they've got some drooping skin and they're a bit wrinkly. So this doesn't look like that, but for all I know, she could have had Sculptra. I like the idea. Sculptra plaster makes it, sound a little ridiculous, but Sculptra is actually not a ridiculous treatment. Whatever the hell this is in here, she just looks uniformly swollen. So I don't know what that was. Again, we're back to the pictures that we saw in the beginning where she's very red and you can see these marks on her skin that are very kind of grid-like with pigment. This could be RF microneedling, but probably not. This is probably fractional laser or a BBL or IPL.
Women will hide themselves away in caves like bears while taking hundreds of selfies like this they'll send to friends and family.
And here I think she's just trying to get a double chin and not look great. I think that's pretty funny.
Family who will lie and say,
it's not that bad. I will say she's incredibly swollen in this picture. Can you tell? I mean, obviously she's just, her whole lower face is poofy and swollen. So wherever she's doing this, she's clearly doing it when she's not filming SNL because this would take a few days to recover from.
It's not that bad. This year, I pledged to stop the cycle. Just kidding. I'm going Friday.
So I just love Chloe for putting this out there because, there is a reason that the med spa industry is a $20 billion industry. It's probably more. I've been saying that word now for a year. It's probably more than that. A year later, the industry just keeps growing and growing. But there's a reason. It's because, it really, a lot of our treatments, as long as you stick with the safe ones and go to a really good provider, they really help your skin. They really help you look like you've got fresh, younger skin. And it really helps to get rid of those sunspots. It really helps to tighten up those wrinkles, gives you better tone and texture. So we really do have some good treatments, and it's just important to do your homework. Make sure you're going to someone really fantastic. And remember that that these treatments do have some downtime, and you are going to be, puffy sometimes, and you are going to be red or have some, whatever the sequelae are, but they do generally go away. And luckily, for the most part, if you go to a safe place, anything that does happen that's, downtime is temporary and will go away. And that temporary could be a few hours to a few days. If you do laser treatments that are way more aggressive, in one of the articles that they interviewed Chloe about, she mentions Fraxel by name. It's a pretty aggressive resurfacing laser that most of them have two wavelengths, one that's non-ablative, but one that's ablative. And that one has quite a lot of downtime. 1 to 2 weeks of your face is sort of off. You can't leave the house kind of thing. That's a pretty aggressive one. I personally prefer non-ablative laser resurfacing because the recovery is much, much quicker. Yes, it does require more treatments, but it's much safer. So in someone like her, she's got very, light skin, light eyes, light complexion. The risk of complications is a little lower in someone like Chloe than in someone like me. Even my skin's sort of medium tone. I've got brown eyes. And anyone with darker skin, it can be quite risky. So I don't generally recommend a more aggressive laser like Fraxel or a CO2 laser. Those have a much longer recovery time, 1 to 2 weeks. Most of the things that we do have a very short recovery time, measured in hours to days. So, and then very rarely could you have a permanent bad complication. The most dangerous thing is filler, and we've talked about that. You can have some very bad consequences if you do filler, and that person gets an occlusion, meaning puts filler in a vessel and then doesn't know how to treat it. And that's very, very common out there. So look for great treatments. Look for ones with minimal downtime. Look for providers who are really skilled in what they do. And look, hopefully, for a certified spa that's certified by the Men's Spa Board. Anyway, thank you so much, Chloe Fineman. I think you're amazing. Thanks for listening. If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.